Every case is a lesson. Our Case Closed series breaks down real malpractice claims so podiatric professionals can learn what went wrong, how it was defended, and what to do differently. This is one of those cases. A 58-year-old patient was referred to a podiatrist for a possible rupture of the left Achilles tendon. She also had tendinitis in both Achilles tendons. An MRI confirmed a partial rupture on the left side. The insured discussed treatment options with the patient and her husband. They chose surgical repair. Before the procedure, the insured reviewed the risks and benefits again, including infection, re-rupture, and chronic swelling. The patient signed the informed consent form and was scheduled for preoperative screening. Surgery was performed without complication. The patient was discharged with a removable walking cast and instructions to remain non-weight-bearing on the left foot, perform range of motion exercises, and report any shortness of breath. At her 1-week follow-up, she was healing as expected. Sutures were removed a week later. The incision was well healed. She had no complaints of pain. Then, the insured's assistant called to confirm her next appointment. Her husband answered. He said his wife had died the previous week from a blood clot. The insured immediately called the husband and offered his condolences. The husband confirmed she had experienced some shortness of breath 2 days before her death, but no leg pain or problems from surgery. An autopsy revealed bilateral pulmonary thromboemboli and residual thrombi in the left popliteal and distal venous system. The patient's husband filed a lawsuit. Allegations included failure to order adequate prophylactic anticoagulation therapy for a high-risk patient, failure to disclose the risk of DVT in the informed consent, failure to recognize her elevated risk for DVT and pulmonary embolus given her BMI, age, and surgery to the lower extremities, and failure to refer her to appropriate medical specialists for prophylactic anticoagulation management. The defense acknowledged this case would be challenging. A patient had died, which would generate sympathy from the jury. There was no clear standard of care for prophylactic anticoagulation, and the damages could be significant. Still, the insured was an experienced podiatrist with an excellent reputation. He was credible and compassionate in his deposition. After careful review, the defense team and the insured decided to take the case to trial. The trial lasted 2 weeks. The jury returned a defense verdict in favor of the insured. A patient died, a husband lost his wife, and a podiatrist faced a 2-week trial, not because he was careless, but because documentation gaps left him exposed. The jury sided with the insured, but not every case ends that way. The decisions you make before something goes wrong determine how well you can defend yourself if it does. Document your DVT risk assessments, have the informed consent conversation, and make sure it is in writing. Educate your patients before they walk out the door. To learn more information on Achilles tendon repair complications and DVT risk management, and to download the case study, visit our website.